Joining me now is Dr. Rajib Dasgupta, is a member of the National COVID Task Force. Thank you so much for your time, Dr. Dasgupta. What is your take on this system that has been adopted by the WHO to arrive at a conclusion that the death figure vis-a-vis COVID-19 deaths in India is actually 10 times more than what the government has said?
Thank you and good evening. I think a distinction needs to be made that these are not COVID deaths, but these are excess deaths attributed to the pandemic. And to that extent, there is a fundamental difference, and therefore both the technical discourse and the media discourse needs to take that into account. Now, having said that, the WHO puts out a long 30-page note on the methodology. And for India, it does specifically mention that because all-cause mortality data were not available at that point, a subset of 12 states for which data was available has been taken and extrapolated to the country. Now, I think India, with its very robust public health institutions, universities, and other academia, a very large body of academia, can certainly run this model, given that the methodology has been spelled out. And now that we have the 2020 civil registration system data released just 2 to 3 days back, India should also run that model and come up with definitive figures with which this discourse can continue forward, so that we are also able to come up with what we believe are the true figures of the excess death associated with the pandemic.
But Dr. Dasgupta, India has said in a press statement, a strong one at that we did share our data, but the WHO has not considered the data that India has essentially shared. So is it a case of the WHO not trusting a member state with its data?
Well, India, as the report stated earlier, this is going to be placed in the executive board. India currently is the chair of the WHO executive board, and the Health Ministry of India will be representing both India as well as chairing that board. And I'm sure with India's chairpersonship there would be a good academic and technical engagement. But having said that, now that even if as India says, WHO did not take that CRS data into account, we can certainly now apply that data and come up with a figure that we believe is more realistic than what's come out in this report, on which there is unanimity or near unanimity that it's way too high, even based on lived experiences.
But Dr. Rajib Dasgupta, in fact, if a country as large as ours is saying that, look, if you've collected data only from 12 states, it does not give an accurate picture. Our method of collecting data from 7.9 lakh collection centers, here's our system. It's a robust one. It's extremely efficient. It's a large network of 3 lakh data collectors and a reliable system that we've been using for COVID or no COVID. Why can't you consider this data? But the WHO goes on to publish this data in spite of objections, 10 letters written by the Union Health Secretary, and puts out a footnote at the bottom talking about India's CRS and the data under the Registrar General of India. Do you think that's fair? Do you think the WHO has been fair to us?
WHO has now come up with a statement that now that the CRS 2020 has been released, they will run the model again with those. And as I said, India should certainly do that and come up with a set of figures so that it can take the WHO estimates head on. Now, at the same time, the methodology does take into account a very, very large range of factors, and all of which make certain assumptions. And therefore, while it adds many layers to try and make it as robust as possible, some error would creep into all these through all these layers. Now, having said that, WHO therefore also comes up with a lower level of estimate and a higher level of estimate. And therefore, if India can actually run this again, we can see whether our own computations lie more towards the lower end or even lower than the lower end for that matter, if we are actually right about it, most of the death has been captured. but certainly there's a room to engage in that exercise, and I believe that would be a very, very powerful argument on behalf of India.
Absolutely. Give our answer in the form of our data, which is much more reliable than the data that has been put out by the WHO. Dr. Dasgupta, thank you so much for your perspective on that important story.